So how do we define body dysmorphia?
Well, body dysmorphia is a kind of a new term that isn't well defined. I think often people use it to refer to body dysmorphic disorder, also known as BDD. And body dysmorphic disorder is a mental health condition, common one actually, in which people who are normal looking, often very attractive people, think that they look abnormal and they look ugly. And some use milder terms like "I look unattractive," others use more extreme terms like "I look hideous," "I look like a monster." And in reality, the flaws that they perceive in their physical appearance are things other people can't see. So the flaws they perceive are non-existent or slight in the eyes of others, but to the person with body dysmorphic disorder, they look huge and awful. So they have distorted body image. And then in addition, uh, for a person to have BDD, body dysmorphic disorder, they need to be thinking about it a lot, kind of obsessing about it, for at least, about an hour or so a day, in total, thinking things like, "Oh, my skin looks terrible," or "My nose is misshapen." It can involve pretty much any part of the body. And on average, people with this disorder obsess about these perceived flaws, which they perceive, but others really don't, for about 3 to 8 hours a day on average. Um, Another part of the definition is that the preoccupations with the perceived flaws in appearance trigger repetitive behaviors, like checking mirrors a lot or comparing your own, disliked body area with the same body area on other people. Sometimes excessive grooming, if you're really unhappy with your hair and trying to fix it. And these kinds of behaviors can take many hours a day. And then finally, and I think very importantly, we don't wanna misdiagnose kind of normal appearance concerns, which most of us have some of, right? And most of us would like to change something about how we look if we could. But we don't wanna call kind of normal appearance concerns body dysmorphic disorder, a psychiatric issue that needs treatment. So it's very important when diagnosing the disorder to ascertain that the preoccupations with perceived flaws in appearance have been quite distressing to the person, maybe making them anxious or very ashamed or depressed, um, and or cause impairment in their day-to-day functioning, right? Difficulty being around other people because you think people are thinking you look ugly, or difficulty going to school, or challenges doing your work because you're distracted by these thoughts, these obsessive thoughts that, oh no, there's something wrong with how I look. So it's the preoccupation plus significant emotional distress or at least moderate impairment in day-to-day function. It's usually both distress and impairment in functioning. So that's a brief definition. Body dysmorphia is a colloquial modern term, like it's sprung up just in very recent years. And sometimes people misapply it to refer to the body image concerns in eating disorders or more normal body image concerns. But I think sometimes people use it to refer to the disorder, body dysmorphic disorder, also.
So there is actually a difference between the two in terms of what they mean? Or is it maybe just like a nickname that people are giving it in terms of it having to rather than say one extra word?
Both. I think often people use it as kind of a nickname for body dysmorphic disorder. Maybe they don't like the disorder part of the of the problem, right? But I do think it's not a well-defined term. There's no universally agreed upon definition. So sometimes it's a little unclear what people mean when they're using it.
Yeah, okay.
If
That
someone uses
makes
that term, you always need to ask, "No, are they talking about body dysmorphic disorder? Or are they talking about normal body image concerns, which are not body dysmorphic disorder? Or are they talking about the body image concerns that people with an eating disorder, like anorexia nervosa or bulimia nervosa, might have?" So sometimes it's a little bit confusing um, when that term is used.
is it a fairly new phenomenon, disorder? Is this something that humans have actually had and evolved with? Because I my mind springs to the idea of this idea of trying to present yourself in a certain way is something on an evolutionary perspective that we've probably tried to do for a long, long time for mating, reproduction. But where is it potentially? Is there a moment in time where it's become something more excessive?
That's a great question because it's so easy for us to think, oh, this is because of social media, which is pretty recent phenomenon in the history of mankind, right? I agree with you. I think there's probably an evolutionary basis. This disorder usually starts around puberty, not always, but often when mating becomes important. And, I suspect it does have an evolutionary basis. It was first described, so it's probably been around forever, right? Millennia, at least, maybe more than that. But it was first described in the 1800s. And it was really overlooked by almost everybody, amazingly, because we now know this is a really common disorder. It currently affects probably 2 to 3% of the population, maybe more than that, actually. So it's more common than obsessive compulsive disorder or anorexia nervosa or a whole lot of other psychiatric conditions. But it was just overlooked for so long. And when I started my work on body dysmorphic disorder in like early 90s, virtually no one had heard of it. The public, professionals, I think in part because of the shame that a lot of people with this condition feel. They feel that they are defective in terms of how they look, and they worry people are gonna think they're vain if they say anything about it. So it's it's an old problem. It's been around for a long, long time. I think it's just in recent years, past few decades, as scientists, and clinicians like myself have started studying the disorder, trying to understand it. What are the symptoms? How do we identify it? How do we treat it? I think it's in recent years it's become, much, much better known, which is a wonderful thing because it's a very treatable problem. It's often very severe, but it's very treatable.
Is there any link between personality types, those that suffer with it slightly more than others?
You're asking great questions. See, that's a hard thing to study. We do know that people with body dysmorphic disorder tend to have certain personality characteristics, but we don't know if those are risk factors for developing BDD. Were they like this before they ever got the disorder?
Yeah,
Might these
yeah.
personality traits have contributed to their getting BDD? Or conversely, do they develop as a symptom of BDD? So, and we don't really know. So, but personality traits like being introverted, sort of an anxious temperament, a tendency to be perfectionistic, a tendency to be more, yeah, I think I said more introverted, socially inhibited. Um, and some studies show, people with this disorder tend to be more aesthetically sensitive, you put some of these together and you think, yes, you can see how some of these traits might predispose someone to getting the disorder, but we don't really know. And having seen thousands and thousands of people with this disorder over the years, I would say BDD can occur in someone with virtually any type of personality. But maybe it is more likely to develop in someone who's a little bit socially anxious to begin with, a little bit, socially inhibited, perfectionistic, having those types of personality traits, introverted.
My mind leans to perfectionism probably more than anything,
Yes.
and I
Yeah.
said to this before we started recording that this episode was pretty much not only one because I know a lot of people listening will either feel they have some maybe full-blown BDD or maybe some form of it in some shape or form. But for me, growing up with a condition where once I took my top off and would reveal my condition, I have felt this myself. So this podcast was almost a sort of selfish endeavor as well. But interestingly, as you said about young people, it's sort of developing it as you start to get maybe into puberty and you're starting to think about mating and you're starting to think about relationships and things like that. For me, that was sort of when I probably would start to say I'd maybe started to reveal it. But coming back to perfectionism, I am a recovering perfectionist, and having had great academics on the show and studying and researching perfectionism myself in my degree and in my research, it's been a self exploration thing as well. But I can say that I think it would have definitely attributed to it as well. And so with that, knowing what I know about perfectionism and it coming from not only internally and there being a labyrinth of reasons why it comes from internal, also the external and those around you and the environments that you're in and how that can shape it. What do you know about the environments that people either grow up in or find themselves in and its relationship to BDD?
Mhm. Well, I think people with BDD can come from all different kinds of backgrounds, but compared to people without BDD, they do, report having tend to have more often report, say that when they were, younger, that they were teased a lot, bullied, sometimes about how they look, sometimes about their competence. So they report that more often than people without BDD. Um, and so that may be a risk factor for developing BDD. You can imagine how it could be, right? Now we know that BDD is has a big genetic component. So there's no one cause of BDD, and it's probably due to some genetic risk that you inherit, right? Goes through your family tree, and you get you inherit some genes that probably predispose you to obsess and develop the disorder. But then, life events almost certainly play a role. So, reports of teasing, bullying, a number of studies have shown that people with BDD, compared to those without body dysmorphic disorder, and also compared to people with obsessive compulsive disorder, people with body dysmorphic disorder more often report having been neglected, having been abused when they were younger. But again, not everybody has experienced that. But it might be one more possible risk factor for developing the disorder. The family characteristics of people with BDD have not been well studied. So, I think you hear different things from different people. I think each person's experience is unique, but maybe there are some characteristics that tend to characterize early family life. Um, but we don't know much about that. I know some people will say that, they were very attractive when they were younger, and they used to get a lot of compliments. And of course, it's more socially
Mm.
appropriate to compliment a 6-year-old than, a teenager, really, and say, "Oh, so you're so cute," and that sort of thing. And then as they get older, they don't hear that so much, or they hear it from fewer people. And some individuals will say, I learned to base too much of my sense of self-worth on how I look. And that is something we address in therapy with people with BDD, but that's not true for everybody.
I guess that could work the other way though, right? Because you could have someone who is not seen as the attractive person in school and it be an aspiration
Yes.
and they seek it and therefore they become hypercritical because they're trying to reach a standard.
Yes, I think that's probably just as common. Right. Right. But, I don't know that, some people also come from quite healthy families. So, it is hard to generalize.
When it comes to the current situation we live in and the current world that we live in,
Mm,
social media undoubtedly is going to be
mm,
playing a
mm.
role in this. Has it, from your perspective, created an uptick in cases of body dysmorphic disorder?
Probably. I think, um, we don't know that for certain, but, I think it makes a lot of sense that certain forms of social media, right? For example, what we call image-centric, uh, forms of social media that focus on how people look and that present idealized and often unattainable, images of supposed perfection and appearance, uh, types of social media that promote cosmetic procedures, even for people who are already very attractive, that these probably become one more, can become one more risk factor for people who are probably already at risk of getting it based on their genetic inheritance and perhaps other life experiences. Again, we can't say social media is the cause because BDD's been around long before social media
Mhm.
ever developed.
Sure.
But I think, yeah, I think it can probably for some people, it can, it makes sense that it would play a role because it's become such a powerful, pervasive force in our society, and some of it is so appearance focused and often gives the message that you don't look good enough. You have to look better. You have to fix yourself. And when you hear those messages and keep seeing those messages, it's hard to think it doesn't have an effect. And I know for patients I treat who have body dysmorphic disorder, that for many of them, social media can make their, involvement in certain forms of it can make their BDD much worse. So, and cause them to, suffer more and be more obsessed with these perceived imperfections and how they look. And so, one of the things we sometimes do in therapy is patients will decide, I'm going to, close this account because all it does is make me feel bad and obsess more about how I look. And it's kind of toxic for me to be looking at this stuff and spending so much of my time doing it. So some people will decide that's a good idea for them, and it often is actually.
From my world of sport and performance, I've seen, again, still linked with perfectionism, because I just think in general, I see a more perfectionistic world. Very hard to say whether, because I'm studying it, whether I'm going into it with slightly, I'm finding what I'm looking for. But I would say as a general, like, more people are associating with sort of the symptoms and elements of perfectionism. And one of them being this socially prescribed perfectionism, which is sort of outside external forces providing that higher standard, or other people telling you that you need to be at a certain standard. And so in the sport world, you see a lot of young people chasing this sort of unrealistic expectation, a really high standard. But from a body image point of view and a body awareness point of view, literally last night I was out on the seafront, and here in the UK we've literally just ticked over the end of GCSEs, which is our 16-year-olds finish their exams at school.
Mhm.
So they've all exited the schools and they're all out on the streets and partying. And out on the seafront where I live here in the south of England, there were hundreds of kids out, and there's police around sort of monitoring them, making sure they're staying in shape, like they're fine. And the amount of young girls, I would say, that you could tell was so image conscious
Yes, yes.
about. And I was luckily with a friend, and I said, "Do you think this is what it if this doesn't look like what it was like for us
Right.
18, 20 years ago? This
Yeah.
was not what it was like." And I can only think of really the addition of social media, the addition of more imagery, the propelling of these influencers and icons
Yes.
of the image that they are presenting and showing. And again, as we know, that is not always the truth. An image that is not truthful, an image that is not real, that has been changed by some form of filter or technology, that has clearly had, you're sort of seeing this, the rubber is meeting the road where these kids are standing, as the change, and they're all trying to look either the same or outdo the one next to them.
Yes. I see something similar here in the US, and it's sad. They seem so much more appearance focused, than when I was growing up here, and, posing for selfies and putting on even more makeup out in public. And, it's, um, it's disheartening because I think it almost certainly, it can increase anxiety about how you look. It can, propel people to get cosmetic procedures, which sometimes end up looking very strange and, can involve risks, medically, psychologically. So, we know cosmetic surgery procedures are increasing also and becoming fairly mainstream. And Yeah, I feel we're losing, what happened to other aspects of ourselves, like
Mm.
hopefully a lot of people have still held on to that, but what else makes you who you are? It's not just, how your nose looks or, whether your hair looks perfect. It's so much more than that. And your personality traits, your values, your talents, etc. And I worry that the basis of self-esteem is becoming very narrowed for a lot of people, and it has become very focused on physical appearance. And then some of the social media world just amplifies that.
What from your experience has cosmetic surgery done with people with body dysmorphic disorder? When they go and have surgery, does it help them? Does it alleviate their problems, or does it kick the can down the road?
No, it's not a good idea. It's really a bad idea, because most people with body dysmorphic disorder do get cosmetic procedures of one sort or another. Dermatologic treatment is most common because skin and hair concerns are the two most common concerns of body areas
Okay.
that are most often disliked. But surgery, yeah, about 25% get surgery, often a nose job, rhinoplasty, other kinds of cosmetic treatments. And as best we know, the good studies that have been done on this indicate that it almost never improves the body image concerns overall. So when I say overall, sometimes, maybe 20% of the time, people with body dysmorphic disorder who have a cosmetic procedure, think that the treated body part looks somewhat better. It's maybe 20%, only 20% of the time. But overall, BDD gets better only about less than 5% of the time. So why is there that discrepancy? I think it's because most people with BDD worry about more than one body part. So if you get one body part
Mm.
cosmeticized, you get some cosmetic procedure, you still have all these other concerns, right, that still bother you. Or in about maybe 40% of people, they get a cosmetic procedure. Okay, they think that's all right. And then they switch to a new body part. They develop a new concern. And this makes sense because the problem in body dysmorphic disorder is not with how people actually look. It's with how they see themselves. It's their body image. It's distorted perception of how they look. And so if you change a surface characteristic, right? You put in a chin implant, that changes actual appearance, but it doesn't change body image. They tend to still be obsessed with minor or non-existent flaws in how they look and to obsess and worry about it. So it's not a good solution, and sometimes people get much worse after they have a cosmetic procedure. I have recently seen a number of people with body dysmorphic disorder who got very suicidal after a cosmetic procedure, because they thought, it ruined how they look. Well, they still look fine. There's nothing wrong with how they look, but it's their perception that the cosmetic procedure made them look even worse. And again, their perception is inaccurate, right? Their brain is too good at seeing detail, and they have trouble recognizing that itty bitty things are really just tiny. They're not huge and prominent and something that other people would notice. So we don't recommend cosmetic procedures, because I always, uh, everything we know suggests that they don't help people with body dysmorphic disorder and can actually make it worse. I've seen so many people say, I've had so many patients say to me, tell everyone, if you have body dysmorphic disorder, don't get surgery. Don't get a cosmetic procedure. It ruined my life. The usual outcome is no change. So the usual outcome is not horrible. It can be, but usually it's no change in their obsessions with how they look. But that's not a positive outcome if you've spent a lot of money. Maybe you've had downtime to recover. Maybe it's been painful. That's a disappointing outcome. So almost no one with BDD feels, you know, better, overall in terms of how they look.
I guess they're just shifting the crosshairs,
Often
aren't they?
they often shift to something else, or they're still worried about other things, or sometimes people are satisfied temporarily, and then over time they don't like what was done. They see a little asymmetry. They notice something that wasn't, in their eyes, perfect about the surgery. It's not exactly what they had hoped for or wanted, and they can start getting obsessed again with that same body area.
Can they shift those crosshairs, or do you find that they shift those crosshairs to someone else? So in relationships that they then start to look for other people. So I kind of think of the person who has the nose job and then looks at their partner's nose and goes, "Oh, you could kind of get that too." So do people with BDDs tend to start to outwardly express it to other people?
Well, there is yes, there's a form of body dysmorphic disorder called body dysmorphic disorder by proxy. Proxy referring to somebody else. I'm not sure how often it happens after they've had a cosmetic procedure that they don't like themselves, but yes, it can focus on other people, perceived flaws that the person perceives in other people's appearance. A partner, yeah, maybe a wife, fiance, girlfriend, boyfriend, a child. And it can be so disruptive to the relationship. And I have seen, young men who were engaged to be married, and then they said, "I don't know if I can go through with this because, my girlfriend's hairline is receding, and, she looks terrible. When I look at her, it's all I can see." And it can be so disruptive to relationships. And, we've been able to successfully treat people with this form of BDD. And then, you know, wow, that's great for the relationship, right? But, we don't treat it by saying, have your girlfriend get a cosmetic procedure, right? We treat it with medication and cognitive behavioral therapy, a form of therapy called cognitive behavioral therapy for BDD. That's the standard treatment. And we can use it for this form of BDD. I've seen parents who obsess about their child's appearance. In one case, a 2-year-old who the mother thought her nose was misshapen, which it wasn't, and wouldn't let any family visit the child, wouldn't take the child out of the apartment because she was so, you know, embarrassed by the child's nose. And the child was a perfectly adorable little girl. So sometimes, yeah, this is a less common form of BDD, but can be very problematic.
Look, my thinking goes to sort of where we're heading with it, because if we're growing up in this more perfectionistic world and lifestyle, and the images of each other that we're just altering or we are perfecting over and over again, from what I know from perfectionism, is there's this, and it's the one that I've actually done my research in, which is called other orientated perfectionism, your want for someone else to be perfect. So you see it in teachers, leaders, coaches, that you want someone else to be perfect, but you could see it in relationships as well. "Oh, I wish they would act that way," or "I wish they would do that." And you set a standard for someone else to uphold. But then as we now grow up in a world where parents are more frequently being open to cosmetic surgery, to alterations, and if we say generally that BDD is on the increase, then surely there's going to be a transference to the next generation. And will it get worse? Will it just increase? And is it going to go on the up, and where does it end?
Perhaps. And I think as parents, you have to be so careful, right? Not to overemphasize the importance of appearance, and, to emphasize that other things really matter a lot in life, right? That your values, how you treat other people, um, you know, are you doing good in the world? Well, these are some of my own values, right? I suppose. But, we have to be so careful because I think our youth are being bombarded by social media, by everything going on around them that overemphasizes the importance of appearance and emphasizes that perfection, which, is by definition is just really not attainable anyway. And so I think as parents, we have to just be very careful not to, overemphasize perfection. Of course, striving to do well is one thing that's worthwhile, right? But perfection is that who is perfect. So we just had to be kind of aware of our our own behavior, especially around kids, and not be overly focused on their appearance, not conveying that appearance is the most important thing. Um, Certainly not telling our kids they should get plastic surgery, right?
Mm.
Um,
Have you, when it comes to men and body dysmorphic disorder, I've heard a term bigorexia.
yes, yes.
And from what you've described about body dysmorphia, the wording of body dysmorphia and body dysmorphic disorder, bigorexia, which for people that, and I'm sure you'll be able to talk to this much better, but from my understanding is it's this feeling that you're never big enough in men. So men putting on size and muscle because they don't feel like they're ever big enough. Talk to me about bigorexia, where it sits in the body dysmorphia, body dysmorphic disorder world.
Yeah. Bigorexia is also called muscle dysmorphia, and it's just what you said. It's usually boys and men who think inaccurately, think that they're just not big and muscular enough. They're too scrawny. I think sometimes it's tied up with a sense of not being masculine enough for some. And in reality, this is body dysmorphic disorder because it's an inaccurate perception. And in reality, boys and men with this form of body dysmorphic disorder, again called muscle dysmorphia or bigorexia, um, they look normal, and some look hugely muscular. Now, you cannot, and everyone has probably seen these kind of extreme images. You can't attain that look just by working out, right? And eating a high protein diet. Um, you can attain that hugely muscular look only by using uh, anabolic steroids, injectable drugs that are usually obtained illegally, and that create huge amounts of muscle. It's a fake look, and I think a lot of people realize that, and it's potentially quite dangerous, actually. About 40% of boys and men with muscle dysmorphia use this class of drugs, anabolic steroids. It's different from steroids you might take for asthma or something like that. They're muscle-building drugs, and they're bad for your physical health. They lead to early heart disease for a lot of people, heart attacks at young ages. Um, People have probably heard of something called roid rage. They can
Mhm.
cause
Yeah.
aggressive behavior. Um, People can get very depressed when they come off of them. They can be people can get addicted to them, can abuse them and become physically dependent on them. And I think this is another form of BDD where social media, I worry, is really fueling this form of BDD. And because you can find all kinds of stuff online, where people are encouraged to take potentially dangerous drugs, not just anabolic steroids, but a whole bunch of them that can really be toxic to your body and your brain. Um, and I'm glad you mentioned this also because it reminds us that BDD affects boys and men as well as women. Among adults, BDD, about 40% of people with BDD are male. So that's another important thing to keep in mind.
Well, I think definitely a lot of men, hair would be a consideration. Maybe
Yes.
skin, not
Yes.
as much, but for
Yeah,
me,
no, it's the same.
oh,
Yeah.
is it? Okay,
Yeah.
interesting. That's interesting. That's only anecdotally I'm thinking there.
Yeah.
But definitely hair. I mean, I chose to shave my head when I was 12 or 13 years old. I just did it as a bet, and it stayed like this, and I have big curly hair, and yeah, I have always stayed like this. But there are people that definitely make comments about someone who, like myself, who has a bald head, and you can tell that it's not coming from a place of security when they're saying that. So that's always an interesting experience. But when it comes to the body, I found it interesting because I've actually, over the last year, put on muscle myself. I've actually grown. I've put on 10 kilos, maybe actually more now, but I've done it through a functional reason that I wanted to feel stronger. I wanted to work. But having been a professional athlete, I have always stayed away from exogenous substances. So never been able to take steroids because you'll just get banned. But I don't want to take them, and I would like to just be able to get to the stage where I feel strong and healthy and at a size where I feel capable, because I have to admit that there is an element of when you build size as a man and you feel stronger, there is this feeling of capability that you feel, and you feel more like a man. It just is. I can't describe it any other way, really. And there is that line that has to be drawn. And when it becomes, I have to be bigger, I have to get more, I have to be more. And for me, then it sort of starts to borderline on this narcissistic form. Like, I need to be better than other. I need to look better and be better, because kind of the biggest gorilla in the tribe is going to get everything. So yeah, I have felt that probably more in the last year, of anything, but it's never drawn me into wanting to use some form of exogenous substance to go even further.
Very smart, very, very smart. I've seen very, very awful medical things happen to people, and, some men who've lifted so much, they've spent hours and hours and hours a day lifting everything they could possibly find, and now they're in a wheelchair because they
Mm.
damaged themselves so much. So, yeah, I mean, some working out, of course, is good for us and healthy, but as you said, you gotta draw that line so that you don't wanna cross over into excessive working out, and certainly not using those drugs, which, are really bad for you. So
Yeah, it's interesting where we're gonna go with this, because like I said, we haven't almost had enough time with social media, the impact it's had on body image, the latency effect of people that are going to have taken these corrective surgeries, and what the implications could be down the line. You kind of feel like people are gonna try to make themselves younger for forever. I feel by the time I'm 50, 60, that a 60-year-old when I'm 60 is going to look vastly different to what it looks like now, and maybe the one after that. But what are the implications of that from a health point of view, from a psychological point of view? And do we start treating it early? So I guess with that, what you mentioned CBT, but what are some of the go-to treatments, or maybe even people that are listening that start to hear what we're talking about and think, actually, I do have a level of body dysmorphic disorder. What are the easy, sort of grabbable, low-hanging fruit treatments that they might be able to do for themselves?
we have 2 first-line treatments, and they're both excellent, and they help most people if they are implemented correctly. Um, so one is cognitive behavioral therapy, which people may have heard of. It's for short, abbreviated as CBT, and it's a form of therapy. It's very practical. You learn skills. You learn to overcome your symptoms, and it can be used for so many different issues. We have CBT for depression and for eating disorders and for pain and all kinds of medical and psychological problems. So for BDD, it has to be tailored to BDD's unique symptoms. So you learn to become more aware of your negative thoughts about how you look, and to develop, which are, inaccurate, right? And so you learn to develop, take a step back, recognize inaccuracies in your thinking, and learn to develop more helpful and accurate beliefs related to the body dysmorphic symptoms. And also learn to cut back on all those repetitive behaviors that the body image obsessions trigger. So, like the mirror checking, that's a toxic behavior. People feel very driven to go check themselves in the mirror, and they usually feel worse. So try and help people find different ways to cut back on the mirror checking, cut back on the skin picking if they're doing that, excessive grooming, etc. Get those behaviors under better control, and use your time for better things, things that aren't distressing, that don't feed the BDD obsessions. We also help people. A lot of people with body dysmorphic disorder are very socially avoidant because they think they look ugly, and that other people think they look ugly, and they feel anxious and embarrassed around others. We help them learn to gradually feel more comfortable going out and doing things. And so we try to help people no longer avoid social situations, which most people with BDD do. Most of them avoid at least some social situations. We also help people to develop a more holistic view of how they look. Because when people with BDD look in the mirror, they tend to zero in on the little things they don't like. dots on their face or, whether their hair is even or not. And we try to, it's pretty much all they see. And we try to help them take in all of themselves, not zero in on what they don't like, to develop a more accurate and, non-judgmental view of how they look. We work on self-esteem also from a we do various exercises to help people develop a healthier sense of self-esteem. So it's a variety of strategies, very practical skills that you learn. In some ways, it's a little bit more like taking a class, than, you don't lie on a couch and just talk, right? You learn very specific skills that you can implement in your day-to-day life. And ultimately, people learn to be their own therapist, which is really cool. It's really great. The other form of treatment that is also excellent is certain medications that are called serotonin reuptake inhibitors, abbreviated as SRIs or SSRIs. And they're very commonly used medications around the world for all kinds of things, for depression, for obsessive compulsive disorder, for all kinds of, anxiety disorders, etc. And the good news is most people don't get side effects actually, or they often get better with time. And most people tolerate these medicines very, very well. They're not habit forming, they're not addicting. There are a lot of myths out there around them. But the reality is most people get benefit from them and don't have problematic side effects. Um, and there are medications like fluoxetine. The brand name in the US is Prozac. The brand names can differ in different countries. Sertraline, brand name in the US is Zoloft. Those are just a few of them. I think the big problem with the SSRIs is that they're usually underdosed when they're used for BDD. Another big problem is people don't remember to take them every day. And if you don't take them every day, they probably won't work for you. But I think these are really both excellent treatments. And the good news is, we don't really know which is better, but I think the good news is that we have two great treatments. For more severe BDD, we recommend both of those treatments together, medication and cognitive behavioral therapy. For more milder, more moderate forms of BDD, I think you have your choice.
Yeah, I feel like I would want to steer away from any extraneous thing to the last resort. It's just a personal preference. I think that would be me. If I'm, but I actually think about what you were saying there is someone who has a condition that is physically visible when, especially when I have a shirt off. I have spent a lot of time having to overcome a lot of habits and behaviors from keeping a towel over my right shoulder when I'm on the beach and things like that. And I love going to the beach. I love being in the sun. And I have always felt that and had to challenge those thoughts to the point now where I've spent a lot of time looking for the positive things. So my left side, which is unaffected, I'm always looking at that and going like, it's doing a great job. It's doing some awesome stuff, rather than honing in on the right side that I could really nitpick and get really in it. And I think my final thing is, are people able to reach full remission, or is it only reduction of BDD?
Many achieve full remission or very, very close to that. And I always like to say, keep trying. If you want to keep trying, I will if I'm treating you. And sometimes, if medicine alone hasn't helped, have you had a really good trial of an SRI? Because when you do, the majority of people find that the thoughts don't come into their minds as often. It's easier to resist those compulsive behaviors, like checking mirrors, easier to be around other people. Often people, as I mentioned, the doses are often too low. So if you go up to a higher dose, like up to 120 milligrams of fluoxetine, if you can tolerate that, which most people can actually, they usually don't have side effects that are problematic. But you can always ask, can you go to a higher dose? We have other medicines we sometimes will add in to an SSRI. With CBT, it's very important to do the homework. You have to practice. You have to write on paper a lot as you're learning it. Then
Mm.
you give up the paper later down the road once you really learn how to just do it and live it. But sometimes people need a little bit more CBT or maybe a few more session, extra session a week. And if you have CBT alone doesn't work, add medicine. If medicine doesn't help enough, you can add CBT. But I would say, if you really work at it, most people get to remission are very close, very, very close.
Yeah, I would say that I've probably got close to remission. I sort of feel the whispers of it lingering, and then I'm able to reframe that. And I think my mindfulness practice has played a good role in that, and being able to reframe and notice what's going on. Look, Katharine, thank you so much for your time and for coming on. Where is the best place for people to follow along with what you're doing and read more of your work and even your books?
Oh, yes. Well, I do have some books on body dysmorphic disorder. One in 2017 is my most up-to-date book. One in 2009, Understanding Body Dysmorphic Disorders, actually more up-to-date than my earlier book, The Broken Mirror. Because we've learned more about BDD over the years, so that's a source that might be helpful. There's my colleagues and I have published a cognitive behavioral therapy manual for therapists to use when they treat body dysmorphic disorder with CBT. Can be a little tricky to treat it with CBT. So our manual it's called Cognitive Behavioral Therapy for Body Dysmorphic Disorder. It's available on Amazon. It's kind of a step-by-step guide for therapists to use. I also have published some articles on the International OCD Foundation website on medication treatment of BDD and sort of pitfalls to watch out for and how to get a really good trial. So if you want to go to the IOCDF website, you'll find some blogs, some articles of mine there.
Fantastic. Everyone, Katharine Phillips, thank you so much.
Thank you so much for having me.
There you go. Well done for getting to the end of the episode. Thank you so much for listening and watching. And you heard us talk a lot about perfectionism. And I had Dr. Gordon Flett on the show previously, probably one of the godfathers of perfectionism research. And if you want to listen to that episode, all you have to do is click right here. Go on, go.